Welcome to a lifetime of smiles. I'm Dr. Apeksha Anand, and my specialty is Pediatric and Preventive Dentistry. And folks, prevention is the need of the hour so that we can prevent oral health problems instead of treating them. I've divided the presentation into three age groups because there is a lot of anticipatory guidance to be given at each stage. So let's start with the newborn and toddler years. Did you know 60% of all Indian children have cavities? That is a huge number, right? Let me start this with a shocker. Each of these children are less than 4 years in age. This is what I see in the clinics every day, and this is what we're trying to avoid in this young age. How do you avoid this? What do we do that we don't end up with children of 2, 3, 4 year olds getting cavities of that extent or even at all? So, before the teeth erupt, it's extremely important to start cleaning the baby's mouth with a cloth, a muslin cloth, or a finger brush. The child should know that you are going to clean the mouth once in the morning and once in the night, that mama is going to do this. What happens when the baby is teething? All hell breaks loose. Of course, it's so much fun. The babies look so cute, but probably the night's sleep is lost. They're crying a lot. They're fussing a lot. They're putting everything in their mouth. There are so many changes that are happening. So, what are the teething signs and symptoms? A lot of people say that when the child is teething, they tend to get a fever. However, the body temperature can only get raised by 0.2 to 0.5 degrees, not more than that. Any more fever is a sign of an infection and has to be treated differently. Of course, there are behavioral changes like we spoke right now. The children are fussing, they're a little bit irritable, they want to put things in their mouth. And because of the gum irritation, they tend to do that. They put things in their mouth, which is why it's a good idea to provide them teethers. Let's talk a little bit about breastfeeding and teething. There is a lot of biting happening at that particular time. The next thing that happens when the baby is teething is the latch changes. They are nibbling on the breast many a times and not taking the entire areola the way the mothers have been taught that the child should be feeding. They don't take the entire areola inside the mouth and feed. So it's very important, especially when they are dream feeding or when they are feeding in the night, that the child has a good latch. Now, what happens if the latch is not good? The milk pools in the front part of the mouth instead of dribbling into the throat. It pools in the front of the mouth, and if you are not brushing properly, if the child is not allowing you to brush properly, there is a lot of plaque on the teeth. And if there is plaque on the teeth and there is milk surrounding that plaque, the bacteria in the plaque are going to ferment that milk and cause acid. They create acid, and if there is acid surrounding the teeth are going to get decayed. So how do we make it easier for a baby that they don't feel uncomfortable during teething? The most important thing is massaging. All right, with a clean finger, you massage the gums, and they can self-soothe by holding a teether, biting on teethers. These are all different kind of teethers. If they're feeling discomfort at the back of their mouth, a long teether helps. If it's in the front of their mouth, a short teether helps. How do we alleviate the pain that the young children are feeling? There are various methods. Allopathic medicines are available, which is painkillers. Homeopathic medicines are very, very, very common and popular. Ayurvedic medicines, there are certain flowers that Ayurveda suggests help in alleviating discomfort of the tummy, of the nerves when the child is teething. And of course, every house has their own home remedies. Teething foods to alleviate discomfort of the gums, like hard breads, teething biscuits, and breast milk lollies, which are quite popular nowadays, are a good idea. Now, extremely important, from the first moment that the teeth have erupted in the mouth, it is important to start brushing the child's teeth. Whether you use a toothpaste or not is besides the point. But the mechanical motion of brushing your child's teeth is extremely important. Now, please take note of these pictures. All of these pictures are pictures of teethers. They are not toothbrushes. What do we look for in a toothbrush that we want to use for our child? It should have a small head and it should have extra soft bristles. This is in the beginning when the child's teeth have just come out. Within 6 months, we have to change the type of toothbrush. Also, what kind of toothpaste? Very commonly I am asked, what kind of toothpaste should we be using? Most parents go for non-fluoridated toothpaste. But in a country where 60% of children are getting cavities, it's very important to use fluoridated toothpaste. India is not a fluoridated country. There are few pockets of areas where the fluoridation in the water is very high. But say a city like Bombay or Delhi, there is no fluoride in the water. So it's very important for us to use fluoridated toothpaste. And we're looking for a toothpaste that has 1100 to 1500 ppm of fluoride. Also, it is important to note that you cannot use this toothpaste like you use regular toothpaste. You have to use it at this young age, you have to use it in a rice grain amount. That is all. So up to 2 years, you use as much as a rice grain, and after 2 years, you use it as much as a pea size. It's very important that you're able to see the child's teeth when you are brushing. Please consider that if you have not been able to observe yourself brushing your child's teeth, then you have not done it properly. So it's extremely important that you do, stabilize the child when you are brushing their teeth. Make them lie down, or you can sit with another person, sit knee to knee with another person, and put the child in between the two of you all, and then brush the teeth. Or you put the child's head in your lap. But it's always, always, always important that you lift the child's lips and cheeks to see the teeth when you are brushing the teeth. If you can see, that means you have done a good job. What's happening around 6 months of age? The child is teething, they are fussing. The pediatrician is probably telling you that they are, the weight is enough or not enough. And if the weight is not enough, then you need to make them eat more. The children have already started on solids. So when you want to make them eat more, you're going to add sugar to the food. And if the child says, no, I won't brush my teeth, the germs are going to eat the teeth up. That's as simple as it is. A lot of parents feel that if they add jaggery or honey to the food is more nutritious. Yes, jaggery does have a little bit more iron. However, it is still sugar. Jaggery and honey are both around 80% sugar, and maple syrup is about 70% sugar. And sugar is a major cause for cavities because sugar is sticky. It gets stuck on the teeth and is an easy source of food for the bacteria which are living in the plaque. Now let's start with the middle childhood years. The teeth are changing in the middle childhood years. From 6 years to about 13 years of age, the milk teeth are falling and the permanent teeth are coming into the mouth. What we look at these ages are habits like thumb and digit sucking. What happens when the habit of thumb sucking continues? There are consequences that are there. The palate becomes V-shaped and thinner. The palate becomes higher. There is crowding in the front teeth. Mouth breathing. This is a habit that the children develop because they are not able to nasally breathe. It's very important for us to understand that the nose is a filter of the body. If the air that we're taking in is not cleaned by the nose, then we are creating more problems for the body. Also, breathing through the mouth creates other issues like the growth of the face changes. Let's have a look at the next slide. Now we have two girls here, one in blue and one in red. The girl who is in blue was breathing nasally as she was growing, in her growing years, the middle childhood and prepubescent years, and therefore her face profile is normal looking. The girl in red was breathing through her mouth in the prepubescent and early childhood years, which is why her midface has increased in size. She has a small lower jaw. This is what we call bird faces. This is what happens and is a negative consequence of breathing through the mouth. So it's important for us to break habits in the middle childhood years. Now let's get to the adolescent years. The most important thing that we're looking at in the adolescent years is the high incidence of gum diseases and cavities. And that is all because of hygiene. Why does this happen? The causes are braces, hormones, genetics, and late night studying and snacks. Late at night, there is not enough saliva in our mouth, and the snacks that we eat probably don't help the plaque any further. With this, I would like to say the takeaway points from this presentation are brush your teeth well and eat better. Thank you.
Any advice on black stains on teenage anterior teeth?
So, yeah, there are few things to consider where teenagers are concerned and when there are anterior stains. One is poor brushing. If they are not brushing well, then food stains. Indian food has a lot of color. So, there are a lot of stains that get left on the teeth. So, consider telling her to brush better. And the second is something that is not really in our hands. It's called chromogenic bacteria. They create stains on the teeth. So if she has really clean teeth and still there are stains, there's a complete chance that she has something called chromogenic bacteria in her mouth. They create a stain, and there's not much we can do about it except regular cleaning, but it comes back. Uh, it does stop on its own after a certain age, say about 18 years or so. After that, it stops completely. The bacteria just get eradicated from the mouth. After that, the children don't have any issues.
Okay, thank you. And regarding that earlier question, when do we start the
Yeah.
brushing? Before the teeth erupts?
Before the teeth erupt, we have to clean the mouth with a muslin cloth and make sure that the child knows that the mouth is going to be cleaned twice a day. So there are two reasons that we do this. One is that the child gets used to it, and the second is that the parent gets used to it. Because the parents are so scared of putting their hands inside the children's mouth and brushing that they really need to get used to the fact that the hand can be put inside without causing gag to the tooth. So it's very important that both the child and the parent get used to putting the hands in the mouth.
Yeah, thank you. And I have one more question. Regarding the fluoride toothpaste, you were telling that it should be given to the children. From
Yes.
what age you will be suggesting fluoride
From
toothpaste for the
day one,
kids?
from day one, it can be given to the children. All right. First, it has to be used in a rice grain amount till the child is 2 years of age. Just a small smidge on the toothpaste, on the toothbrush, and after that, it can be used in a pea-sized amount. It's a medicated toothpaste. We have to remember that. We cannot
But this
give the child the toothpaste and say eat it.
yeah, pediatric toothpaste are made very tasty. So
Yes,
will that
there
end up
are
in
fluoridated.
kids eating it?
Yes, yes, which is why the toothpaste has to be kept far away from the
Yes,
reach of the child, and we have to apply it just a bit on the toothbrush. Then they
yes.
can eat it up.
Children should keep it
The
up.
reason
Yeah.
that we're asking for such a less amount of toothpaste on the toothbrush is because the children eat it. Any which ways they cannot spit till they are 3.5 years of age. So if they cannot spit, they are going to swallow.
Thank you. Thank you very much, Dr. Apeksha. Thank you.